I wouldn't label it that though.
All right, so in about 30 seconds.
I'm gonna close that door.
It's okay. We haven't got up to it. All righty, you're all good?
Yeah, you're good.
Welcome, my name is Jen Robalski. I'm the director of the La Crosse County Health Department, and it is April 1st, so happy April Fool's Day. I'm going to give an update, again as always, on our case numbers locally and statewide. I'll share a few items of importance, and then I will ask for questions, and I will answer your questions. So, first of all, in the state of Wisconsin today, we have 1,550 confirmed cases of COVID-19. That is up 199 cases from yesterday. In addition, we have 18,819 negative tests. That is up 1,444 cases from yesterday, or tests from yesterday. And that is a percentage of 7.6% of those being tested that are testing positive in the state. In addition, we unfortunately have 24 deaths now in the state of Wisconsin. That is an increase of 8 from yesterday. In La Crosse County, we have still 19 total cases. We have not added any new cases from yesterday. We continue to have 2 that are hospitalized, again, not in critical condition. We also have an additional 3 that have recovered. So we're up to 12 individuals who have recovered. So that's very good news, and we do not have any deaths here in our county. Our percentage for those that are being tested and coming out positive is 3.4%. And our testing criteria is a little bit broader than the state. So we expect that number to be a little lower than the state, but we think the 3.4% compared to 7.6%, that there is also some indication that our spread is less than in other parts of the state. So that is all good news here in La Crosse County. One of the first things I want to talk about is Easter. The Easter holiday is approaching us. That is an important time for many individuals in our community. And I want to just acknowledge that while it is an important time, and we hope that churches and other mechanisms of celebrating Easter are doing that virtually, we do not see Easter as an exemption to the governor's order in regards to the safer at home recommendations or the order. So really what we're asking you to do is not to congregate for Easter services. That includes not driving up in cars and doing it in other means. It really should just be still staying at home. I next want to talk about there has been some concern in our community about groups gathering, particularly teenagers. Having a teenager myself, I first want to recognize that we have to send this message to the parents out there. So if you are a parent with a teenager, I want you to perk up and listen to this. We really need to make sure that our teens are first and foremost feeling supported right now. This is a difficult time for our teenagers. They are in a situation where they're not in structured school like they're used to being in. Their homework has changed, their schoolwork has changed, they are not able to see their friends every day. Thankfully, they have technology. We can support that with them connecting via phone, other means through social media. There are a lot of aspects that teens use there to connect with their friends. We do not want them hanging out in groups in the community, in each other's houses. That is not in alignment with the governor's order. So we really ask and plead to parents to support their kids in other ways and really letting them know that it is not okay to be hanging out in groups. We do have an informational item that we'll be pushing out to school districts that we hope schools will push out to parents as well as another means of getting this information out. But it is something that is titled Supporting Teens Through COVID-19, and it talks about making space for showing emotion and expressing emotion. This is already something we struggled with before COVID-19 came about. We need to make sure that our teens understand that it's okay to show emotion. That might be anger, it might be sadness, it might be a flat affect where they have no emotion at all. But if there's been a change in your teen, for example, now's the time to check in with them, let them know you care. We know that the single most important thing to teens is to have an adult in their lives that cares about them enough to bring up the topic. So sometimes that has been a person at your child's school, is someone they really connect with, and if they don't have that connection any longer, we need to take that on as parents and make sure that they feel supported. Secondly, emphasizing social distancing. Our teens can be asked to be a part of this with us. They are part of our community. They are smart, strong individuals, and we can ask them to be a part of our response, which includes social distancing and helping them understand the importance of that with regards to decreasing the spread of COVID-19. Supporting remote schooling is something that we can do, and also just generally encouraging healthy habits. So those are things like sleep and nutrition and exercise. So this is making sure that your teen is doing all of those good healthy habit items. Again, when they're outside of the normal structure of the school day, or whatever their structure was before COVID-19, we need to help them with some of that structure and guidance. So that would be my message to parents with regards to teens, because we really want to see less gathering of teens in our community in order to decrease the spread of COVID-19. So those are, I do just want to say that we have talked about our strategy with regards to primary prevention, secondary prevention, and tertiary prevention. On the secondary prevention side, just to remind you, that means identifying cases early and limiting the spread. So in alignment with that message, what I want to say today is that we are still testing on a strategic level, and I did mention earlier that we are testing a little bit more broadly in our community than the state is testing. We know that that is frustrating, that individuals in our community would like to be tested, would like to know if they have COVID-19, and are not able to get that testing. I want to acknowledge that. I think that is frustrating, but because of the supply issues with testing, we have to remain patient until that opens up further. In the meantime, it really is something that we ask for your help on. So understanding that you play a significant role with regards to this secondary prevention side. This is not just us looking to our hospital systems or our healthcare providers or others in our community. This is where you really come into play. And I think that's empowering to say you matter and what you're doing helps us all. So again, just a reminder that we need to be staying home, particularly if you have any symptoms, whether those are unknown to you, if you have something that might be allergies, you just aren't sure what it is, this is the time to stay home. This is not the time to do essential travel. Send someone else to do that for you from your household who isn't having symptoms so that you are not unknowingly spreading COVID-19. So those are my updates at this time. I'll now take questions and answers. Or questions.
Question, if someone is going to the grocery store and they come home, is there any protocol that you recommend for them as far as taking their clothes off and getting them immediately into the washing machine? What's some advice you give for people who go out to the grocery store?
So the question is, when you go to the grocery store, what should you do when you're done at the grocery store? So my recommendation is exactly what I do myself, which is I am careful at the grocery store what I'm touching. I am not touching my face while I'm shopping in the grocery store. Before I leave the store, if I can, I'm washing my hands with soap and water. If you have hand sanitizer in your car, put that on in the car. If you don't, you should not be touching your face while in the car. You should not be eating while in the car. So the purpose is to make sure that thinking about your hands being contaminated potentially from touching things in the store, that you would not want to pull those to your face in any way, shape, or form, okay? Until you can get home and you can wash them with soap and water. So that would be the most important aspect that I would tell people in order to prevent the spread. And think about things like your cell phone your steering wheel, that if your hands are contaminated and you're touching those items, you're probably gonna wanna clean those with a Clorox wipe or some other mechanism of cleaning, because otherwise you wash your hands, you go touch your cell phone again, and you're recontaminated, right? Similarly, if you buy a bottle of water at the store and you wanna drink that, maybe you don't think you're eating, but if you touch the bottom of like the lower part below the cap, and then you're touching that to your mouth, so think creatively outside the box about ways that germs can get into your mouth, eyes, and nose, and make sure that until you're able to wash your hands with soap and water, that you're really careful.
Do you have any recommendations for their clothes, or are those fine, or should they go right in the washing machine?
So recommendations for your clothes, we indicate people should sneeze into their sleeve. So we do not believe that clothing contamination is something that will spread COVID-19.
Earlier you had talked about kind of the lack of resources in terms of doing the tests. I guess, will anyone with a compromised immune system get a test? And I mean, if they have symptoms, and if they're over 60 years old, will they automatically get the test, or how does that work?
Okay, so the question is, would folks that are over 60 and or if they have a compromised immune system, would they automatically get a test? It's difficult to answer that question because it depends upon where they're going for healthcare. If they're going somewhere that's sending the test to the state lab of hygiene, that would be different than if a local center is doing the test themselves. In general, it goes with regards to their risk level and their chances of having severe disease. Right now, the priorities are really with those that are hospitalized and healthcare workers that are exposed and symptomatic. So they could, but it is not a guarantee.
Okay. And then some people with disabilities are having issues with area businesses kind of going up to the window and trying to access some of it. They are concerned that some of the businesses will no longer work with them because of the 6-foot rule, not having enough staff, et cetera, kind of stuff like that. Have you heard these concerns from community members at all?
So the question is, and you might have to clarify this, but the question is about those with disabilities and whether or not that there will be enough staff at local businesses to support the need to assist those with disabilities. Is that right?
Yeah, kind of that, and kind of, I think we've heard a couple of things where, people with disabilities are just outright turned away because they aren't able to drive, so they have to go up to get food and whatnot, and like to pick up orders and whatnot.
Okay, so the fact that those with disabilities might be turned away because they may not be able to drive there and get the food. I have not heard that, and that is discouraging to me. I think we should be doing everything we can to raise up those that we would consider to be in particular populations that need more help. That's what we call health equity, is making sure that we raise up those that might need additional assistance. And so I would expect that stores would be looking to support that population, and I haven't heard about that, but I am discouraged to hear that, and I think we need to do everything we can to support those that have a disability. They are just like the rest of us, but with a disability, and I think they need that extra support, and they should be able to get it.
Absolutely. And then how might businesses weigh the safety of employees as well as their customers' needs with the governor's order at this point in time?
How might businesses weigh the safety of their customers and their employees within the order? So assuming you're talking about businesses that are still operating as an essential business. So when I think about, there are lots of different kinds of businesses that are still considered essential, and it may vary depending upon the kind of business. But first of all, I would be so glad to hear that they are really caring about their employees and also thinking about those who are their customers. I think that the main message would be that they should be attempting to have folks work from home if possible. So that is possible in some situations, of course not for many, like healthcare workers and grocery store supporters. But I would want them to have very good policies in place about illness and symptoms, and making sure that individuals who are experiencing any symptoms can come forward without retribution, that they are not only encouraged, but they are being screened to know what symptoms people are experiencing, because otherwise we're going to have individuals who don't think that it's anything to be concerned about. They're working and potentially spreading the virus, or they're coming to the store or business as a customer and potentially spreading the virus.
you mentioned there is a testing supply issue right now as far as getting those out. Can you explain where the supply comes from, and is this kind of a bigger issue than just Gunderson or Mayo itself?
Yeah, so the question is the testing supply concern and where does it come from? It is bigger than Mayo and Gunderson. It is national. There are supply chain considerations that are fragile, and what that means is, first of all, there is a medium, like a type of product that is in the bottom of the tube that after they do the swab, they put that into the tube. That medium has been in short supply. In addition, there's been some distribution challenges, so making sure that it is equally distributed to those that need it, just like personal protective equipment, making sure that that is organized and being distributed appropriately. So there are a number of challenges with that, and I know that being that that is a national issue, they are working really hard at many levels to get that more in alignment with the need so that we can test more.
Is it more with private companies though, or with state agencies that kind of distribute things?
So the question is it more with product companies or state agencies? My understanding is that it is with those that create the products and also with those that distribute it.
Cities like Milwaukee and Madison have sort of moved to public isolation centers. Is there any plans for La Crosse moving forward, looking at that sort of route?
So the question is there a plan in La Crosse for an isolation center? So let me first explain what an isolation center means to us in public health. So when we think about needing to tell someone that they have been exposed, and if they're not symptomatic or they are symptomatic, that they need to be in quarantine or isolation. Particularly if someone does not have a home, so let's say they're homeless, they do not have a place to go to quarantine and isolate. This is different than generally well population of those that don't have a home, or generally well population of those that are maybe transient. We are looking at the isolation center is a place where we can take someone who's been exposed or has symptoms, maybe they're in the process of being tested, or we're working on getting that going. In the meantime, we don't want them out there in the community potentially spreading whatever it is until we know what that is. That's what we call an isolation center. We already have that in our community, and we already have an individual in that center, and we have a public health nurse from our facility, from our health department, who is supporting that effort.
As far as nursing homes, how is the health department monitoring symptoms that may be popping up inside of nursing homes?
So the question is monitoring of symptoms inside nursing homes. So almost, I think, a week and a half or 2 weeks ago, one of our public health nurses, the sole job of that individual was to call and speak with all of the nursing homes in our county. And just like what we're gonna do with stores, we're gonna call and assess what are they doing in terms of their protection of their employees and their customers. Same thing happened with long-term care facilities and nursing homes to say, how are you managing your staff? How are you making sure that you're protecting your residents? And we had a number of recommendations that went into place, and we found that they're doing a really good job, and they've just improved that as time has gone on. So we have somebody particularly in contact with all of those locations, and I've heard from several of them, but they're doing a really, really good job. They don't even let their healthcare workers come into the facility until they're screened by a nurse. So they're checking over all of their symptoms. It's not where they just sign a form and say, I'm symptom free, and they come in. It's much more active and assertive, and I think they're doing a great job.
Going back to the Easter sort of thing coming up now, what would you recommend for families? You know, they may think, oh, we can have 8 people together for dinner, and we're all family. So talk a little bit about what you would suggest. Just don't invite family over, I guess.
Yeah, so the question is, who can you have over for an Easter dinner? The answer is your household members. So let's just take an example of, I live in a lower apartment and there's an upper apartment. This isn't my situation, but it is a situation I'm aware of. And I have, 3 people in my household, and I have family members that live in the apartment above us. We are not household contacts. They are in a separate apartment with a separate entrance. That does not mean we can get together and have an Easter meal together. I know this is hard, but we're doing this for a reason. We have deaths across this country. We have to take this seriously. This is one of the things that we can do, is to minimize the spread by having a different mechanism of connecting to our loved ones. And unfortunately, right now, that cannot be a meal with anyone outside of the household.
As far as the people that have been tested positive for the disease in the county, do you know how long generally the symptoms have lasted? Obviously, there's 14-day quarantine, but do you know how long they've been afflicted with these?
So the question is, how long have the individuals that we have cases of in our county, how long have their symptoms lasted? So just to go back, they become recovered officially when they have been at least 7 days from the start of their symptoms, and they are 72 hours where their symptoms have improved and they don't have a fever and they're not needing to use cough suppressants or fever reducing medications. So in general, that has been about 14 days, give or take. And typically we've seen their symptom onset is in between 4 and 7 days from the time when they might have been exposed.
Hey Jen, we got a question on Facebook. People are wondering if the low case numbers are due to social distancing, and there's some community concerns that because the numbers are low, that people are becoming more laxed or not worried anymore.
So the question is, are the numbers low because of social distancing, and is there a possibility that complacency is happening because of the low numbers? Great questions. First of all, I would say it is very possible that the numbers are low because of social distancing. We have done a very good job in this community, not perfect, we definitely can improve, but we have done a good job in this county. But I think now is not the time for complacency, as I'm sure you would expect me to say, because if we do not remain and stay the course, we will see those case numbers go up. This is spread from person to person. This is, we think back about how this disease transmits, and that's how it works. So if we're more together and we're not following the order of staying at home, we're going to see additional spread. We're going to see additional cases.
Are you still seeing a lot of people getting tested? What are the testing numbers per week like? Are they still as high as they were 2 weeks ago when this started?
So the question is, are the testing numbers still about the same as what they've been, more or less? And yes, I believe that is the case. I've not heard that testing has gone up or down significantly.
I did have one more for you in regards to kind of deaths from coronavirus here, or COVID-19 I should say. I know that there hasn't been any in La Crosse County, and I realize that these hospitals here serve a 21 county area. I guess in terms of all these other health departments and whatnot, if someone were to die here at either Mayo or Gunderson, are they required to send out information that someone has passed away, or how would we get that kind of information, or is that just county to county?
So the question is, if someone passes away from COVID-19 at one of our hospitals, who learns about that, who knows about that? So that will go back to the county of residence. So if someone is in the hospital now and not a county resident of La Crosse County, we aren't going to know about who they are. We won't know that they're hospitalized there. We won't know that they pass away there. But what we are going to try to do in the next couple of days and early next week is we want to connect with our county, our fellow county health officers and partners to talk about if there's a way that we can bring data together to support that interest in the community. And that could include Houston County and Minnesota as well. Just because we know that we have more of a regional health center here, it wouldn't be the entire 21 counties that the health systems cover, but we think that that could be valuable to our community members, being that we do move across county lines for work and where we live. So we'll be discussing that, and we'll see if we can bring that to the community.
Oh, Jen, sorry, we just got one question as you guys are finishing up. Somebody's asking about going to polling places next week.
So the question is, should you go to a polling location?
I think the question is about how to keep yourself safe at polling places.
Okay, so how to keep yourself safe at polling locations. That's a good question. I think if you think just about how you would do other essential travel, so we do encourage people to vote, that is important. You need to take the same precautions as you would going to the store or the pharmacy. So it would again be that you wash your hands before you leave home. When you're there and you're touching items, make sure you're not touching your face. that when you get back in the car, you're not eating, you're not drinking, without sanitizing minimally, and then washing your hands with soap and water again when you get home. Okay.
Anything else you'd like to add?
No, I just encourage our community members to stay the course. It is tough, but we can do it together, and we will do it together. So we are going to move, just so you know, from daily media briefings to Monday, Wednesday, Friday media briefings. We'll still take your questions in all the same ways that you've been sending them to us, so let us know. We want to be a resource to you. We just think that we can be more efficient and effective by doing 3 times a week going forward. So we'll see you again on Friday.
Thank you.
Thank you.